there are three classes. One is the ergot derivatives, adrenergic alpha blockers, then antihistaminics. These are the three classifications of 5-HT antagonists, and the ergot derivatives are the ergotamine, LSD means lysergic acid diethylamide, and another example is 2-bromo LSD, and another example is methyl sulfide. These are the examples of the ergot derivatives. And the another classification is adrenergic alpha blockers. The classical example of this category is phenoxybenzamine, whereas the another category is antihistaminics like cyproheptadine, cinnarizine, and chlorpromazine, and also the morphine, etc. And these are the morphine is not this class, and these are non-selective and interact with several other receptors as well as also. And the selective 5-HT3 antagonists, example the ondansetron, granisetron, remosetron, and palosetron and allosetron. All these are the selective 5-HT3 antagonists. And this block, depending upon the depolarizing type of the nature of the particular agonists, and the 5-HT exerted through 5-HT receptors on vagal afferents, that's the GIT, as well as the nucleus, tractus solitaris, and chemoreceptor trigger zone. So these are going to act on this particular thing. And the indications of the selective 5-HT3 antagonists are the especially in case of nausea and omission following administration of highly emetic, just like anti-cancer drugs. So anti-cancerous drugs are highly non-selective and they induce severe vomition. Hence, the regular antiemetics are not useful in such situation. And so there is indication of the 5-HT3 antagonists. And hyperemesis of the pregnancy. So there is pregnancy induced vomition is also there. In that thing, all this ondansetron, granisetron, remosetron, etc. are given. And another important syndrome in case of human beings is the irritable bowel syndrome, or in the short form it is called as the IBS. In this irritable bowel syndrome, the clinical signs are the cramping, abdominal pain, and recurrent defecations. So in these situations also the 5-HT3 antagonists are very commonly they are useful. There is a variety of the drugs are there, starting from ondansetron to polonsetron, and the chemical nature of these things are the ondansetron carbazole derivative, granisetron is the indazole derivative, and dolasetron is a indole moiety, and isoquinolone moiety is palaenosetron. So all these are the 5-HT3 antagonist, whereas the palaenosetron is having 5-HT3 antagonistic activity with highest affinity. That means very, very specific. The half-life of the drug is ranging from 3.9 to 40 hours, especially palaenosetron. It's a very long-acting 5-HT3 antagonist, and whereas the other three are little bit short acting. The dose ranges from the 0.15 to ondansetron, whereas 0.25 mg to palaenosetron. The common side effects of these drugs are diarrhea, headache, and lightheadedness, and the hypotension, bradycardia, chest pain, and allergic reactions are the some noticed side effects of these particular drugs. And the another category is 5-HT2 receptor antagonists. So 5-HT3 receptor antagonists are very commonly used in clinical practice, whereas the 5-HT2 are indicated in the limited what you call as the clinical situations. Just like the examples of the 5-HT2 receptor antagonists are trazodone and nefazodone are the classical example. So it's a primary metabolite of M-chlorphenylpiperazine. It is a potent 5-HT2 antagonist and alpha adrenergic antagonist also. So in the indications of these drugs is in the depression and anxiety both, whereas the side effects are hepatotoxicity, sedation, postural hypotension and priapism, and all these things are the common side effects. And this is one of the very commonly used drug, that's the cyproheptadine. It primarily blocks 5-HT2A receptors, whereas the additional H1 antihistaminics, anticholinergic and sedative properties it has got. So the cyproheptadine is very commonly prescribed for increasing the food intake or appetizing agent, and also it is indicated in intestinal manifestation of carcinoid and post-gastroctomy dumping syndrome, and also cyproheptadine is prescribed in migraine prophylaxis, whereas it causes drowsiness, dry mouth and confusion and sometimes the ataxia, and weight gain will be there because the person who has consumed the cyproheptadine will take lot of food. That's why there is undue weight gain will be present. And this is one of the very important agent that increases the appetite and has been used in children and poor eaters to promote weight gain also. So it's a very commonly used drug. And the another disease is known as the Raynaud's disease. It's the release of the serotonin locally from platelet trigger acute vasospastic episodes of larger arteries, and the ketanserin has prophylactic values in Raynaud's syndrome. So what happens in case of Raynaud's syndrome? It is release of serotonin locally from platelet trigger. So locally in case of the hands and other parts. So what happens because of this thing? There is low oxygen and the hyperemic changes will be there. Blood returns to the greater extent. So there is tingling effect and inflammation of the hand, and for such thing the ketanserin, say 5-HT2 antagonist, it's very commonly used. And the another thing is the methyl sergide, the congener of methyl ergonomine, and it's a potent 5-HT2A2C antagonist and acts on 5-HT1 receptors also. The methyl sergide is indicated in migraine prophylaxis, carcinoid and post-gastroctomy dumping syndrome, and the side effects are usually abdominal, pulmonary and endocardial fibrosis. So any drug which is having effect will have a side effect, or any drug which is claimed to have no side effect will not have any effect. And ketanserin, it's also Raynaud's syndrome, a drug of the choice in case of Raynaud's disease, and selective 5-HT2 receptor antagonists, and ritonserin is a 5-HT2A agonist and additional weak A1H1 dopaminergic blocking activities. So the ketanserin, it is antagonizing the 5-HT2 induced vasoconstriction, platelet aggression and contraction of airway smooth muscles. So the important indication of this thing is in Raynaud's disease. So I already told there will be localized release of the serotonin which causes the irritation of the hand, etc. Then the ketanserin is the selective agent to block this thing. And clozapine, it is an inverse agonist at cerebral 5-HT2A2C receptor. So you know what is a inverse agonist? Means the agonist will bind with that of the receptor and brings the opposite action. So indication is resistant case of schizophrenia. And the other drugs like risperidone, olazapine, quetiapine are the combined 5-HT2A plus dopamine and A2 antagonists. So an indication of all these drugs is in the schizophrenia or altered behavioral changes. And some of the drugs affecting the 5-HT2 systems are there, and the first and foremost of this thing is the 5-HT2 5-HT synthesis inhibitors like chlorphenylalanine, or in short for it is called as PCPA. It selectively inhibits tryptophan hydroxylase enzyme, which reduces 5-HT level in the tissue. So this hydroxylase enzyme is the first enzyme which converts 5-HT 5-tryptophan to 5-hydroxytryptophan. So this drug is having some clinical importance. And another step in case of the 5-HT synthesis is uptake. The tryptophan is uptaken from the nerve endings, and the selective serotonin reuptake inhibitors are very commonly used in clinical practice, especially as mood elevating agents. Selective serotonin reuptake inhibitors. Please remember this thing. And serotonin and noradrenaline reuptake inhibitors are there. So sometimes it's non-specific also. And some tricyclic antidepressants inhibit monoamine reuptake and interact with muscarinic, adrenergic, and so many receptors, H1, 5-HT1 and 5-HT2 type of the receptors. So what happens is ultimately the 5-HT 5-hydroxytryptamine is not formed, and hence there will be opposite action. The receptor will not be stimulated by the 5-HT, and there is deprivation.